And I want to be really clear about something on the spiritual path, that we are not bypassing work that needs to be done with a therapist. So if you're having traumatic flashbacks, I would first ask, are you seeing a therapist about that? Because what I'm talking about here is mostly self-created suffering. It is still dealing with small level trauma, but deep trauma and those flashbacks that can come back and can often feel like PTSD, that needs to be dealt with a therapist. And I'll tell you, there's a phrase for it in spirituality called spiritual bypassing, where we jump into these spiritual teachings and practices. But if you're doing it with some trauma in your system, where yourself, the self that we're looking at in spirituality that is not real, cannot also be traumatized, because otherwise you will get so far in spirituality and all of a sudden that trauma will just come flashing back in a huge way. And so my advice with, so I'll say it too, if it's deep traumatic flashbacks, then I think it's something that should be worked out with a therapist, because there's something there, it's still coming up, and if it's still coming up, maybe it still needs to be dealt with. But I will mention, maybe not trauma so much, but really, really, really little t trauma, like the little traumas that we're all a little bit traumatized. It's just our culture, right? We were all brought up. Dr. Gabor Mate talks about this, where everyone's walking around with a little bit of trauma. We're just not brought up in natural ways for humans. In that, and I'm even thinking for those of us that were born in the 60s, like myself, we saw the Leave It to Beaver family on TV, but we weren't having that at home, right? Both parents may be working, not getting enough nurturing, enough care, and it can be really traumatic for us. I'm still talking the little kind of the everyday. It can be traumatic for us. And it is important that we know how to be with those emotions as well. If it's not something that we really feel like we need to go and see a therapist about, but how do we be with that? And there's a lot of work by Dr. Siegel, he's a meditator as well, a Buddhist as well, and a psychiatrist, about reparenting the inner child. Really talking to ourselves. So I'm talking specifically now just about, for those of us all walking around with that kind of trauma from our childhood, of really coming in and saying the words like self-compassion. It's the self-compassion practice also of saying oh, sweetheart, you are loved. You're okay. You're safe. I'm here for you, right? So there are ways, and I'm just kind of bringing up one specific situation of little traumas that I think so many of us are walking around with, that we can reparent ourselves to make sure that we feel cared and loved for and nurtured. And it really does change our relationship to that memory in our brain, because the memory is no one was there for us. We felt alone. We felt like we weren't being loved, right? Even if we were, but we didn't feel it. And so we can change that neural pathway, that memory in our brain, that every time that flashback happens of a feeling of being alone, of feeling excluded, of feeling like we're not accepted, we're not a part, of reparenting that inner child inside, right? But if it's deep trauma, I really do suggest. I think it's important to explore deep trauma with a therapist. You can be doing it alongside spirituality, that's no problem, but it shouldn't be a substitute for therapy. There's a place for therapy.